So we're just continuing with the lip area, and we're using a softer product than Kiss because the client did not want high projection in her lips. In other words, very big lips. But we did use Kiss for the corners because to raise up the corners you do need something a little bit stronger. But now the rest of the lip zone is being touched up with Global Action, which is a softer Kiss, and that's exactly what the client wanted. She had a little bit of lowering on one side of the lip versus the other, so one side of her lip was falling. You can never correct that unless you have surgery. The client does not wish to have surgery, so what we're doing is trying to correct that visually with a little bit of filler. And now we'll balance it out. So we go to the other side of her lip, and just to make it proportion, which would be this side here, and to bring that down a little bit, and we go deep from the inside. Okay, and there we go. So now less of a visual droopiness on one end, and we'll have you face straight. There you go. So something that was more problematic for the client has been improved. Not only will she see an improvement in terms of the balancing of the lip, but also the quality of her hydration will also improve because the products with Teocel, the hyaluronic acid, which is what the body already has, and the face is lost as we age, and you're going to see a replacement. And in combination with the puncturing technique, the skin will revitalize. So you basically have more of a hydration happening, not just a volume. Very nice. So there we go. So now we've seen the corners raised up, and you've seen a little bit of icing on the cake with the Global Action on top of the Kiss. And you have a very natural look. You have no change in terms of the individual's appearance, natural appearance.
I'm going to raise a little bit.
Yeah,
for apex.
and you'll do the Cupid, the heart of her lip, which is called that nice little Cupid area. And we'll kind of lift that up to give it a nice perch. So we don't go near the border because we want to keep the product within the lip line, not go past the vermilion border. And the injection technique by the injector, Marina, is nice and slow. She's very gentle and using the right precision in terms of amount applied. Okay, very nice. Very nice. And then to the other side, just going to bring the camera over. For those at home watching this, it looks painful, but as you can see, the patient is quite relaxed. Okay, go lower. Very good.
So slightly.
Yeah, so there we go. A little bit more of an enhancement to her Cupid. And this is where the injector works as an artist. So basically, rather than using one tool applied to the face, the injector is smart enough that she uses a combination of products that TLCL provides, which we refer to as a menu. The reason we have this menu is, like anything else in life, people have different tastes and therefore different requirements. It's the same with the facial volume that people lose. not all products are serving for all individuals, so it's important your injector is able to switch products accordingly to the individual's loss of volume. So we're not inflating, we're restoring volume, and there's a big difference in that. Very good. So this is just massaging it in. The global action is very soft, and it would give a very soft, natural volume to her lip. The Kiss is a very strong projection, so for someone that wants Vavoom lips, it's probably the perfect product for them. And there we go.